Welcome, and thank you all for joining me today. As you may notice, my office is a bit unconventional, but I assure you, the neurological conditions and treatments you're about to see and the impact they have on my patients are very real. I'd like to introduce you to Teresa. How are you, Teresa?
I'm doing great, actually.
Teresa experiences chronic migraine with a headache on more than half the days of the month. Several weeks ago, we treated her with CGRP antibodies. CGRP is a protein that's involved in the transmission of the pain of migraine. The antibodies actively block the receptor sites on blood vessels or attach to a protein itself so it cannot fit into the receptor sites, helping to prevent the series of events that leads to a migraine. So Teresa, how have your migraines been since treatment?
They're definitely less intense. I haven't had to miss work since starting my medicine. Oh, and I haven't seen any blurry rainbows during my headaches.
Oh, those are called scintillating scotoma, or auras, and I'm glad they're gone. The CGRP antibodies will remain active in your body for weeks or even months. We'll continue to monitor their effectiveness at your next visit and make sure you're prepared with an effective acute treatment for any future attacks. In the meantime, try to avoid stress and your known triggers.
Like my boss?
And eat regular, healthy meals. And try, I know it's hard, to practice sleep hygiene. No naps, no TV or phone in bed. You have the list. Sound doable?
I'll try. Thanks so much.
Hey, Mark. I'd love to talk to you next.
Hi, Doc. It's good to see you.
Mark's here for a routine follow-up because it's hard to tell, but last month, Mark suffered a major ischemic stroke. So unlike a hemorrhagic stroke caused by a ruptured blood vessel, a blood clot formed in a vessel in Mark's brain and completely blocked the blood flow. Fortunately, his wife remembered fast and recognized the signs of stroke in his face, arm, and speech and called 911 immediately. We were able to get him in and do a thrombectomy within 6 hours of his stroke onset. That means we threaded a tiny catheter up through the blood vessel to retrieve the clot and restore blood flow.
It still sounds like a sci-fi movie to me, Doc.
Well, it is pretty cool. What's great about this breakthrough procedure is that if it's performed within a few hours of the stroke, you drastically limit the potential damage to the brain. And Mark's had a really smooth recovery. You're walking and talking normally, your blood pressure and cholesterol numbers look good, so keep up the healthy diet changes we talked about and don't forget to exercise.
3 times a week. You got it, Doc. Thanks.
William, how are you?
Not too bad.
Good to hear. William has been diagnosed with Parkinson's. This disease affects the nerve cells in the brain that produce dopamine, which plays a key role in enabling precision of movement. So as these neurons degenerate and produce less dopamine, you see the symptoms including muscle rigidity and tremors, as well as changes in speech and gait. While there is no cure for Parkinson's, there have been some major advancements in treatment to help relieve symptoms. William's difficult-to-control tremor and motor fluctuations on his current medication regimen make him a prime candidate for deep brain stimulation. We'll surgically insert electrodes into his brain, then implant an IPG, an impulse generator battery, kind of like a pacemaker, under William's collarbone. The IPG will send an electrical impulse to the part of his brain involved in motor function. William, I'm confident that deep brain stimulation treatment will help you reduce your tremors and greatly improve your quality of life. You can start taking steps to maintain your brain health, and we'll even give you some exercise therapies you can do after surgery that have been shown to really help with movement too, like dancing or non-contact boxing.
I like the sound of that. Thank you.
Let's see. Beth, are you ready?
I guess so. Hi.
Beth is here because we're using an advanced treatment for her multiple sclerosis. So let's start with the MS itself. Beth's immune system attacks her own central nervous system by eating away at a fatty material called myelin. It coats and protects her nerve fibers, so as the myelin is eaten away, the nerves can't send and receive information properly, so the communication between Beth's brain and her body gets interrupted. Beth's treatment uses monoclonal antibodies to alter her body's immune response. These antibodies are designed to recognize and selectively target the immune cells that are contributing to the disease and bind only those cells. Because these target proteins may only exist on a single cell type, we can design treatments to have a very specific effect. And Beth, judging by your latest scans, your MS is stable, and I'd like to continue this therapy.
Wonderful. Until next time, I suppose.
Isaac, how are you? Not too bad. I brought my seizure diary. Great. Isaac was diagnosed with epilepsy almost 10 years ago. Epilepsy basically means he has an increased risk of seizures, which is when his brain's normal electrical activity is altered and lots of nerve cells fire all at once. He was on anti-seizure medication to treat his epilepsy, but his complex partial seizures were difficult to control and continued to progress into generalized seizures, also called grand mal seizures. So we're treating him with responsive neurostimulation. We implanted a device on the surface of Isaac's brain that continually monitors his brain activity, detects abnormal patterns, and responds by delivering tiny electrical pulses to halt the seizure before Isaac can even notice. Well, everything looks in order. Just keep up that diary and we'll see you in about 3 months, okay? You got it. Thanks. Thanks, Isaac, and all of my patients for coming in. And thank you for joining me. None of these treatments would be possible without major advancements made through education, research, and innovation in our field. Because in the brain, every connection, no matter how small, is significant. The same is true of neurological diseases. The cure for one could lead to a cure for many. That's why the American Academy of Neurology is committed to advancing treatments and improving patient outcomes, one connection at a time.